we'll post that on Tobacco Free Colorado in the next couple of days, and you'll have access to that. So if you want to share this with your team members that weren't allowed to attend today or weren't able to attend today, please do so by going to the Tobacco Free Colorado website to access that. Okay, so our trainings we're doing online, and we're going to do a lot of breakout rooms, and there's going to be a lot of opportunity for engagement with other grantees across the state. So I wanted to see if we could do a little bit of practice session. I also would like to be considerate of our speaker, and it's so much more fun to speak to faces than it is to names and initials in a blank screen. So if I could have 5 people turn their cameras on and join me in a really quick kind of little, we're going to call this a breakout session real quick, just like 5 minutes, so we can practice turning our cameras on and engaging in a conversation. So Brittany, thank you. Yay. Yay, Chella. Is it Chella? Perfect. There's 2. Angie and Pete don't count. Let's get 2 more members. Who's got their makeup on and their cameras ready to go, and you're all in your seat, and I see your name so I can call you out. Only because I've worked with you, I'm going to put you on the spot here. Adrian, is it possible for you to turn on your camera and join us? I know you've done this work before. Your thoughts on this? Or Veronica, Jessica?
I think Lucy and Talia both have their cameras on as well.
Oh, great. Let me go to the next page. There you guys are. Okay. Oh, Alberto, hi. Okay, so let's do this. I'm gonna, Alberto, you're gonna know all these answers, so let the other folks kind of have an opportunity. And Angie and Bianca, if no one speaks up, I'll let you guys pop into. Let me share my screen. So part of our work is if they don't have a policy, we want them to have a policy. And if they have a policy, but the enforcement strategy is not one that we would recommend, we want to talk to them about an alternative enforcement strategy. So for the folks that are on camera and looking, I want you to review this document here. So what we have, let me get this down a little bit. Let's see. Okay, so here are 2 complaint protocols. The first one is a market rate housing who have 3 steps. Go ahead and read through those 3 steps. So that's the left column. So this is what the property manager told you their process is, okay? So our process that we recommend is over here on the right column. I'm going to give you a minute or 2 to read over those 5 steps. And so this is what we're recommending, the right column. Okay, so let's open up a discussion. Let's say you're in the manager's office and they have this enforcement protocol, and we want to talk them into our protocol. Let's talk about a little bit of pros and cons. You can also tell me what might be better about their 3 steps if you find something better, or what would 5 steps improve in their process. So all you guys in our little breakout room, let's talk. What's your thoughts about the right column? How do we justify that composed to the left column? Jump in there, guys.
I think, oh, go ahead.
Go ahead.
Okay, I was just going to say, I think the right column would be a little more personal than the left column because you are actually engaging with them. You're not just sending them like the statement, letting them know. Like you're coming off as, being nice and just informing them and just reminding them about it, but they can still see you face to face.
Perfect. Is it Chella or Stella?
Chella.
What was your thoughts?
It's the exact same thing. I think it's more personal, and it's also giving them paper documents.
Your volume is really low. Are you there?
Got better.
That is so much better. It works so much better
like,
on your mouth than
oops.
it does your ear.
Yeah,
Go ahead and repeat that.
I believe it's the same thing. It's more personal, but it also gives them backup copies in case they're not totally comprehending what you're saying. They have the paper copy in front of them that shows them exactly what needs to be done and said. So I believe with the two of them together, it's more personable as well as manageable.
So you like the idea of maybe showing them the comparison of where we can include. I'm sorry, but my screen only lets me see you two. What about you other guys on the call? Would you like to, there we go, I got it. Probably, let me just go back because I don't want to share that. What about Taylor? You've done this work, a lot of this work. What is your thoughts about the two processes?
I think the other column would definitely be a little bit like the left-hand column or the right-hand column would definitely be a little bit more personal. I feel like oh no, sorry, I got my hands mixed up. The right-hand column would definitely be a little bit more personal. The left-hand column would definitely just be like, it's definitely straightforward. Like it's a warning, and then if they don't obey by it, then it's definitely like you have 10 days. For the smoking violation and then your eviction notice. So I definitely think it gives them some time, and it definitely, I think Brittany said, it's a little bit more personable for sure. Yeah, so it's definitely a little bit more personal, and they're trying to make the connection and trying to work things out.
Perfect. That's perfect. Alberto, you can answer this question for me. What's included in the right column in our process that is omitted from their process? There's a lot of things, but what's the main thing?
So can you repeat the question, Peggy?
Yes, you have to pay attention. No, I'm kidding. What is on the right side? What have we included in our process that we think is really important that's omitted from the manager's process on the left?
Yeah, so first there's more of a in-person interfacing, so speaking to the person and helping them understand what are the consequences of smoking, not just for their personal health, but also for, their environment. So it could be their housing space or for their neighbors, and also offering them the possibility for mediation. That sometimes can be really helpful, especially when there's a tenant to land person involved.
Mm-hmm. There's one more really big one, and it's in every step. What are we delivering at every encounter with the smoker?
The resources for the sensation.
Yay! Exactly. Yes. Because we want it, we know, right? We know this. We know that policy works. So policies are first going thing. But a bad policy without an enforcement strategy that works is also just a piece of paper, right? So we also know that policy alone does not help people quit. They need engagement and they need support to quit. But the quitter will never smoke again. The smoker who's going outside will always have an opportunity to smoke inside again. So your best opportunity is to get that individual to quit, although it's not required for housing. It is recommended because that smoker that quit will never smoke inside again. The smoker who's smoking outside will smoke inside on a snowy day. So the best option is to get them to quit, but honestly, getting them outside is the first step, and just offering those cessation resources. So that being said, let me stop sharing my screen. So what we have today is we have an individual who has been instrumental in creating the equitable principles behind these steps, right? We look at these principles and so let me go ahead and introduce our speaker today. Let me get a drink of water first. So Liz is a dedicated leader in the fight for smoke-free environments. She's bringing over 2 decades of expertise in policy change and public health advocacy. And as a project and policy manager at the American Non-Smokers' Rights Foundation, she empowers public health professional advocates and communities with the tools that they need to advance smoke-free policies. So from helping California pass its landmark municipal smoke-free ordinance to tracking state legislation and conducting nationwide training, Liz's work has shaped protections in multi-unit housing, college campuses, and outdoor spaces. With a deep commitment to education and technical assistance, she continues to be a driving force. So today, Liz is going to bring to us the principles of equitable enforcement. And after today, I'd like for her to explain a little bit about her organization as well, because she really needs to be your go-to partner. They do a lot of work on marijuana secondhand smoke, which will enhance your practice as well. So with that being said, I don't want to make you beholden to keep your cameras on, but it is nicer to look at faces than it is to look at tiles. So thank you for all that are participating today. And you will be expected to do this in the training, so get ready for it. So I'm going to get off now, Liz. Thank you so much for joining us today. We look forward to what you have to share with us. I'll turn off my mic.
Okay, thanks. Hi, can everyone hear me? Great, wonderful. Well, first, good morning, and thank you for that lovely introduction. My goodness, that's really very kind. I'm going to take a quick second and share my slides. Let's see, is that coming up for folks? Okay, great. Yeah, so just really appreciate joining you today. And I was asked to speak, like Peggy said, about the principles of equitable smoke-free housing. And, you know, I think it really goes beyond just the enforcement component. And this is about the social justice aspects of both why and how we work on this issue. And I know that Colorado has been a real leader in working on smoke-free housing. There's been great work over the years to educate people and build support for adopting these policies. So particularly glad to join another state that's working so well on this issue. And so I'm going to share some things to keep in mind and help inform your conversations, recognizing that we want to protect people's ability to breathe smoke-free air at home, as well as addressing concerns about the impacts on or potential impacts on vulnerable individuals. So just quickly, I'll mention who we are. We have 2 sister organizations. The A&R Foundation is our educational arm. That's why I'm doing this presentation today under that umbrella. And then A&R is our advocacy and lobbying arm. You might already know my coworker, Sharday. She's based in Durango, and she is our wonderful program and training specialist. We are based in California, but we work around the country. And we've been doing this work for a long time. A&R has been advocating for tobacco control change for nearly 50 years now. And the A&R Foundation has been focused on that education and building a supportive environment for policy change for more than 40 years. So the main goal of both of our organizations is to protect everyone's right to breathe smoke-free air, whether that's at work, at home, or at play. And we focus on a lot of different aspects of smoke-free policy. Some of the current hot topics beyond the smoke-free housing that I'll talk about today are secondhand marijuana or cannabis smoke, making sure we educate people about the health risks, and that smoke-free spaces should be free from all types of secondhand smoke. Also, smoke-free workplaces are a big deal, especially in other parts of the country, especially casinos and music venues. And then preventing rollbacks of smoke-free protections. This is especially prevalent with the cannabis industry trying to allow indoor smoking and vaping in hospitalities. And all of us in Colorado and California, unfortunately, are kind of at the center of a lot of that activity. So to give you an overview, first I'm going to talk about social justice considerations around the need for smoke-free housing, then highlight some of the key policy considerations, then I'll share ideas for taking a health equity approach to these policies, followed by suggestions for some community involvement, and then I'll point out some of our smoke-free housing resources. The starting point for building the rationale for smoke-free housing is to communicate the health reasons, but also the social justice needs for these policies, with that goal to help facilitate the creation of healthier and safer living environments for all multi-unit residents in our communities, including people who smoke in their families. And I want to start us off by highlighting the new Surgeon General's report that came out in November. It's called Eliminating Tobacco-Related Disease and Death, Addressing Disparities. And this report has such incredibly relevant information for our conversation today, but just in general for all of the tobacco prevention work that we do. You may already be familiar with this report, but I'll mention a couple highlights. First, one of the report's main conclusions is that tobacco-related health disparities are a social injustice in addition to an economic and health burden, which I think really sums it up nicely. And this new report also confirms several of these points here. Inequitable smoke-free protections for people living in multi-unit housing contribute to disparities in exposure to secondhand tobacco smoke. That's something we know, but it's so important to have it in official, major report like this. Confirming that exposure to secondhand tobacco smoke remains disproportionately high among children, African Americans, families in lower income groups, and adults without college diplomas, and that these disparities have increased over the last 25 years. Then smoke-free policies for multi-unit housing would reduce disparities in smoke-free protections and reduce exposure to secondhand tobacco smoke if fully and equitably adopted, implemented, and enforced, which I love to see that there. Protecting people from exposure to secondhand tobacco smoke, including exposure to cannabis smoke in all indoor settings, should remain a priority. So again, I think each of these findings, plus many more in the report, are very powerful. Each of them ties directly into the need for us working on smoke-free housing protections and policies. I do need to point out that the CDC page for this report has unfortunately been taken down due to the current upheaval. But thankfully, the PDF link to the report itself does still work, so I'll put that in the chat later. And then something that A&R Foundation has done, we now have slides available about the report from a webinar we did with CDC staff in December, and we put together a highlights document, and we have those available on our training site, Thinkific, so I will share that likewise later. And again, I think it's helpful as part of our communications with community members and housing providers and other decision makers, if we continue to communicate about how smoke-free housing is an important community-wide issue in terms of who's at risk and who remains unprotected. And looking locally for you, 26% of Colorado's housing stock is multi-unit, with it higher in cities. I think Peggy said 55% of housing in Denver is multi-unit. So that means there is an awful lot of residents who are at risk of potentially breathing their neighbors' drifting smoke. Similar to the new Surgeon General's report, a prior CDC Vital Signs report found a lot of similar disparities among who is still exposed. We know that people who live below the poverty level are more likely to live in multi-unit housing, and we also know that the home is still the primary place where children is exposed. We have a lot of vulnerable folks at risk. Also, surveys show across the country that residents want smoke-free housing for themselves, for their families. In Colorado, nearly 65% of multi-unit residents support smoke-free housing policies, even though multi-unit residents do smoke and vape at higher rates than people who live in single-family homes. Again, smoke-free housing can help address these long-standing health inequities, especially in lower-income populations in communities of color who have higher rates of exposure to secondhand smoke, but also higher rates of health conditions that are impacted by that smoke exposure and are more likely to live in multi-unit buildings. And again, surveys are showing that these residents are wanting smoke-free housing, but the challenge is that there is less availability of smoke-free buildings generally than there is demand, and that's especially true when it comes to affordable smoke-free buildings. Also, moving out of a smoky building is not a financial or practical option for anyone, especially in areas that are really dealing with a housing crisis. And we want to ensure that everyone, regardless of their financial situation, has a right to breathe smoke-free air at home, not just people who can afford to live in a freestanding house. And we want all residents to have that healthy, stable living environment. Again, that includes people who smoke in their families too. That's why we want to look at this so holistically. And these are driving principles, but also good messaging for helping to explain why we want more policies to be adopted by our local properties. So next, I want to take a look at some of the key policy considerations that coalitions and community partners can think about when working on this type of policy change. I think it's helpful to see smoke-free housing policy options as a broad continuum. Starting on the left, we have the most accessible and common types of policies, and then we move to the right with more involved and structured policy types. All these policy options build on each other. For example, you're not going to have a city be ready to adopt a local law for smoke-free housing unless you first have some buildings in town that are already smoke-free through their own policy adoptions to help show that smoke-free housing is doable and is liked and is supported. So the first and most common policy type is an individual's smoke-free home policy that they create for themselves and their families. In Colorado, it's around 87% of multi-unit residents already have their own smoke-free home rule, which is very similar to the national rate. And then there's the two blue arrows that are the more formalized, voluntary type of policy is often the term used for them, meaning that the housing provider has voluntarily chosen to adopt a policy for their property. And it sounds like that's where you are primarily working on. The second arrow is the individual property policies that are adopted by landlords and HOAs for the buildings that they own or manage. And then the middle arrow, we have a similar but larger scale type of policy where it may be adopted by a property management company with dozens of buildings, or a regional affordable housing provider, for example, or even that would include like the HUD rule that was adopted for public housing in 2018. And these are larger scale, potentially more formalized, especially when it comes to enforcement protocols, and they're broader reaching policies too. And then we have the jump over to local laws. That's where you have a city or county adopt a local law that regulates smoking in the individual units of multi-unit housing throughout the whole jurisdiction. Local governments do have the authority to adopt these laws the same way that they can adopt smoke-free law for workplaces or parks or other types of spaces. Around the country, there are now more than 100 cities and counties with these local smoke-free housing laws, but the caveat that is that they all are in California at this point. But we know that communities in other states are actively building readiness and starting to look at the feasibility for that policy option. And then the last type of policy on the continuum I put down was a statewide law. We don't have any of those statewide laws yet for housing, and that is perfectly okay to not be there yet. Again, it's all a process, and there's no one right place to be. It's whatever is best for your community at the given point in time. Underpinning, all of these policy options is that essential community education and involvement of residents, of housing providers that builds the capacity and the support and readiness for adopting and implementing each type of policy there. And I want to take a closer look at the two middle arrows. These housing provider policies are widespread. They're adopted by all sorts of, market rate and affordable properties alike. And we know that tobacco prevention partners are working on these policies all around the country. I know, again, that's the current focus for you in Colorado as well. And Colorado has been working with residents and properties for a while now, and it's wonderful that you are continuing on this path. It's such an important area of focus. These policies provide coverage for many residents. I want to point out, the downside to these two types of approaches is that it can be slow to go building by building. And there is always the risk that potentially a new owner or manager could weaken or overturn a policy. So one of the benefits to a local law is that it can provide a bit more stability and covering, a greater number of people. But again, that is further down the road. But again, these voluntary policies are a very important part of the process. They show that smoke-free buildings can work and that there's demand for smoke-free living. It's like how outreach to restaurant and bar owners back in the 80s and 90s to help them implement their own smoke-free business policies, that helped pave the way for eventually having local smoke-free restaurant and bar laws. So these voluntarily adopted policies that you're working on can help increase support and readiness for a local law in the future. There's two policy considerations that I want to mention. This is kind of the gold standard of what a strong smoke-free policy or law looks like, with the caveat that, again, every property is going to figure out what works best for them. But in terms of the gold standard that's been developed, the best practice is that, 100% smoke-free building policy would mean that no smoking or vaping is allowed anywhere inside the multi-unit buildings, including each of the units. And these strong policies apply equally to all types of multi-unit properties. That if it's a local law, that would include apartments, condos, townhomes, and other types of buildings with 2 or more units. And then policies of all kinds should prohibit smoking and vaping in indoor and outdoor common areas. Often that includes no smoking on balconies and patios as well. And these strong policies should apply to all residents, meaning that the policy applies even to people who have been living in the building for a long time. We're not exempting longtime folks and only having it apply to new folks. And a strong policy, again, also applies equally to all types of secondhand smoke so that folks can't smoke or vape tobacco or cannabis. And logistically, 100% smoke-free policies not only better protect people's health and reduce the disparities in who's exposed, but they're also easier for residents and housing providers to understand, and they're easier to implement and enforce. We always like to say that the best policies are simple, strong, and fair without a lot of confusing elements. And I do want to zoom back in on cannabis since it's a significant consideration, especially in states like yours and mine. Surveys are showing around the country that in states that have legalized cannabis, that exposure is increasing and drifting smoke is a frequent source of resident complaints, which you may be hearing. I certainly hear from residents about that. And the fact is that buildings, you can't really call a building completely smoke-free if people are still allowed to smoke and vape cannabis indoors. Thankfully, the norm is now to include cannabis smoking and vaping. That includes HUD's public housing rule, and then nearly 80% of those California local laws are including it as well. And then, for example, our smoke-free lease addendum that we have available for individual building policies, that includes it as well. Including cannabis can be helpful with that enforcement component because it can be really challenging when these products are treated inconsistently. It's hard for a manager to say, hey, you can't, smoke that cigarette, even though it's totally fine for your next door neighbor to smoke a joint in their unit. It creates a lot of both conflict and challenges. And it's an area where we can try to be creative. What about things like creating an outdoor patio for cannabis smoking that's out of the public view that could meet any, regulations that may be in place. And then we also need to educate people about the cannabis health concerns and expect pushback. This is usually an area of a lot of pushback to including it. But the bottom line for us is that smoke is smoke and people should be able to breathe air at home that's free from all types of secondhand smoke exposure. So next, let's focus in on some of the health equity approaches to smoke-free housing. Again, with that goal in mind of protecting both residents' health and the housing stability of residents. Principles for Equitable Smoke-Free Multi-Unit Housing is a short guidance document developed last year by the California Healthy Housing Coalition, and I believe this was shared with all of you before the call. For transparency, I am a member of the Healthy Housing Coalition, and I was part of the committee that developed this document. It was a collaborative process with a whole wide variety of stakeholders. There's tobacco control folks, but also a lot of public health folks from other types of focuses, legal aid partners, tenants' rights partners, and really bringing in a lot of perspectives. And the purpose of this document is to provide some recommendations to communities that are looking to adopt either smoke-free housing policies or laws wherever you are on the continuum. It's aimed to be helpful. And these principles were developed with a health equity lens with that intention to help communities develop solutions that are fair to everyone, all parties, and don't have disparate impacts on lower income residents or other marginalized people. And this process took several years to develop and lots of discussion because we wanted to try to reach consensus, and we know that this is a complex issue. So just to briefly review the 7 principles, the first principle is starting from a place of empathy and respect for all of the stakeholders. We want to recognize the impacts of secondhand smoke exposure as well as the potential negative impacts of enforcement on people who are smokers or vapors. Likewise, it's important to focus on how to eliminate the secondhand smoke exposure and also limit where people can smoke. Second, equitable approaches to smoke-free housing should be developed and implemented with broad and meaningful community engagement. This, to me, is a very, very important principle in my experience. Meaningful engagement includes getting input from a variety of community members, especially the residents themselves, about what their need is for a policy for their building, and what those policy options or provisions might look like. Third is to provide accessible and culturally linguistic appropriate supports, resources, and other accommodations. That would be not just materials in the languages of folks who are in the buildings, but also tools to help residents comply with the new rules, such as access to cessation resources and creating outdoor smoking areas that are safe and accessible for the people that need to use them. fourth is any public policies, and this one is focusing a bit more on the local laws, should apply across all types of multifamily buildings. And then any type of policy should apply to all types of secondhand smoke. So this means both rental and owner-occupied buildings. And then, of course, that's where the cannabis smoke inclusion comes into. And then the fifth principle is the enforcement one, that enforcement must be carefully crafted based on local priorities and available resources. And it should focus on opportunities to support compliance and have a graduated enforcement process. I loved seeing your 5-step process that you were talking about at the beginning of the call. It really ties into this approach. And these policies should, well, when it comes to local laws, we don't want to have police involved with enforcement. That's a bit less relevant when it comes to an individual building policy. Our coalition could not find consensus on the issue of eviction and whether that should ever be on the table. That is by far the most challenging topic. Some of the stakeholders believe that eviction should never be an option, whereas many others believe that it could be the very last option available. So this speaks to that need to have discussions and develop a process that will work for the specific property you're working with or specific, broader community. And there is no one size fits all enforcement protocol. Sixth is having accountability, including having a process for monitoring and evaluating a new policy, and then seeing if there's any adjustments that might need to be made to better suit the needs of the people there, and then to continue to have community engagement and feedback. And then the seventh principle is that an equitable policy is not free. Communities, you need to invest time and resources into those other principles in order to make sure it works well. That includes offering support and cessation, but also having some public health focused enforcement protocols. So again, I'll put the link to the document in the chat, but it's also here at the bottom of the slide. And I want to take a closer look at that enforcement principle. And again, I think you guys you're having a very good conversation at the beginning about not just having the bare minimum of steps, but really having an approach that engages with people, helps them understand why the policy is in place, what they need to do with comply, as opposed to just having a punitive focus. And that's really something we're starting to see more of around the country, both in the communities that are adopting laws, as well as communities that are working on individual building policy development, being thoughtful and intentional about planning for enforcement from the outset in order to support residents and reduce things like financial penalties, and if it's a law, reduce contact with law enforcement, certainly. And again, these approaches are evolving based on what people are finding works well or does not work well, and there's no one right way to enforce a policy. Figuring out what will work best for the residents and management at a given property is a really valuable use of time. We do want to encourage that enforcement engage housing providers in terms of like lease amendments, but also involve public health and community partners if that is a feasible option. It sounds like all of you being able to provide education to these landlords is that type of one of those types of supports. We want to be supporting residents, not punishing them. So those educational resources and cessation referrals are such a key part of the process. We recommended a graduated process like what you were talking about, where residents receive educational information for maybe the first few complaints, and warning letters, having things in writing are very helpful. If there are resources for something like a restorative justice type approach, that could be an option. Some communities are starting to consider that, but that is a very resource intensive option that isn't always possible. And again, some policies do include eviction as that very last step after all the other options have been exhausted. Others don't. The goal is to reduce exposure by fostering good compliance and not putting anyone's housing at risk, because we know of all the health and economic consequences there. And again, it is difficult to achieve good enforcement and compliance when products are treated unequally. And then another key part of equitable smoke-free housing is the community involvement piece. Going back to that second principle, which emphasizes that policies should be developed and implemented with broad and meaningful community engagement. And I think it's so important for residents to be involved in the process, to have their concerns and their needs heard, regardless of what type of property or policy that you are working on. And that, big part of community involvement is both educating and empowering the residents. Communities are being really creative in how they're reaching residents, both to educate them and to amplify their voices. We know that there are plenty of residents who may not have the bandwidth, the time to get directly involved in policy discussions, or they might be concerned about speaking up. So partnering with community-based organizations who already represent residents' interests and who have a respected voice with them can be very helpful. Coalitions have been educating residents in a variety of ways, including things like town hall meetings and community forums, going to health fairs and other places where people are naturally gathering. There's a great community forum like the one highlighted on this flyer that was hosted by an organization that works specifically with the lower income Latino population in the neighborhoods that are highlighted on this flyer, that they are a trusted voice, and the individuals were already inclined to participate with their organization and be open to hearing what they had to say. Coalitions also use these forums. Oops, sorry, let me go back to that slide for a second. Coalitions also use these forums and other types of community meetings to survey participants and collect stories. And then these stories and those survey results can be used to help demonstrate that need and demand for adopting a policy for buildings. These stories can be highlighted in a variety of ways. Some communities have done some social media campaigns. Other times it's flyers to put in the lobby and to share stories at a building-wide meeting. Coalitions have also benefited from involving residents in the actual policy language development and getting their input. And this builds education, it builds buy-in, and also it helps landlords address potential concerns and questions from the outset before the policy is implemented. It's also helpful to find out what residents you're working with care about, what is motivating them, whether it's the health and safety of their grandkids or their pets, or they may care about protecting the environment or reducing fire risk. You can draw people into these conversations about implementing a building policy from a variety of perspectives. A lot of these lessons that I'm sharing were learned and shared with us by public housing authorities as they adopted their policies a number of years ago. And these principles are also being used in campaigns for local laws. So these are helpful things to do across the policy spectrum. And then what can residents themselves do? I often hear from residents who feel pretty powerless, and it's really upsetting to hear about their situations. And so reminding residents that they do have an important role to play in policy development is helpful. Residents can put a face on the issue and drive home who's impacted by exposure, how these policies can make an important difference to real members of the community. Of course, there's always the baseline things like encouraging residents to document their exposure, which helps illustrate the situation, whether it's their landlords or other types of decision makers. Residents who feel comfortable speaking up could ask their housing provider to adopt a policy or speak up at meetings. And it's also important to try to get residents involved in these coalitions since there's power in numbers. And again, sharing their story is so helpful, as is collecting the statements of concern to help demonstrate that demand for change. And then seeing who residents are already connected with. Are there any new community partners that they could bring into the conversation, and both help educate other residents about why a policy is needed, and then also provide input on that policy language development. And then it's also important to educate the housing providers, engage them in this whole process, since they are obviously key stakeholders and often the decision makers in this process. For years, housing providers have been sharing all of the economic benefits that they experience with going smoke-free, including all the benefits that are highlighted on this slide, and also the one that seem a little sometimes don't get highlighted as much in my experience are the fact that smoke-free buildings are helping to attract and retain residents, and how people really see smoke-free living as an amenity that they prefer and would really prioritize when they're selecting a new apartment or condo. And I love this postcard. I found this. This was sent out to Denver housing providers back in 2014 or so, and it did such a great job of highlighting the story of an early adopter, sharing his story about the benefits of their property policy. So there's such, again, longstanding great work in Colorado and resources that have been around to help all of the work that you're doing. In our foundation, we have a fact sheet on health equity and enforcing smoke-free multi-housing. It really is a messaging points type of document to help inform discussions with residents and landlords and other community members. Just a couple of the messages that are included in this fact sheet are: the goal of smoke-free policies for multi-unit housing is to reduce secondhand smoke exposure by fostering good compliance and to support rather than punish residents. Then people who do not smoke, or people who smoke do not have to quit, and people who smoke do not have to move out. People who smoke simply need to go outdoors to appropriate areas to do so. That is such an important common misconception to clarify for folks that can help really reduce some barriers. Enforcement should be a complaint-driven process. Remind people that no one's going to be going out to look around apartments trying to find someone who is smoking. And again, the intention is to build compliance and support where residents who smoke come to understand and respect the policy and understand how it helps their neighbors, even if they don't really like it themselves. That was a message we heard a lot from affordable housing providers and public housing authorities, that folks were understanding why it was helpful to their neighbors, to their grandkids. And they said, I don't like this policy, but I'm going to follow it to be a good community member. And again, that baseline message of residents deserve to breathe the air that's free from all types of secondhand smoke where they live. And so again, these are just some messaging ideas in this document to help with informed conversations that coalitions may be having and to help address some common concerns. And then lastly, just want to highlight some resources that might be able to help support your work. We have a lot of information on our website. This includes getting started advice, tip sheets for landlords, including frequently asked questions and suggestions for talking with residents. We have a sample smoke-free lease addendum, as well as the health equity messaging document I was just talking about. We have a list of the jurisdictions that do have local smoke-free housing laws. And then we have a whole section also on secondhand cannabis smoke, including a regularly updated fact sheet about the latest health information on secondhand cannabis smoke. All of this is available on the housing page of no-smoke.org, and feel free to use and share any of the materials here on this site. And then lastly, ANRF also has webinars and trainings available. Most of these offerings are paid courses or training sessions that are designed to help health departments and advocates and other tobacco prevention partners. We have all the details about those courses on our Thinkific site. It's listed here, courses.no-smoke.org, or also we have a new QR code. One of the courses we have is a marijuana and smoke-free air 101 self-paced training. It's a 4-part series on this hot topic. And then a new offering was added just yesterday, and that's the recorded presentations from 6 sessions from our Clearing the Air Institute that we held in October. One of those sessions is focused on smoke-free housing. It can be purchased as a 6-unit course, or each individual session can be purchased individually. So we just put that up yesterday, and we have a code for a 25% discount through March 3rd. So I'll put all that info in the chat as well. And again, I mentioned earlier, we have free resources about the Surgeon General's report, including the slides and overview document. We also have the report itself, and we have PDFs to the summaries and other types of support documents that CDC provided in Spanish, for example, that again are not currently available on their website. We do not know if those will return. So those are available for free to anyone just by creating a Thinkific account. And so again, all that info is on courses.no-smoke.org, or the QR code. And then lastly, this is my contact information. Feel free to be in touch anytime. Happy to do what I can to support the work that you're all doing. So I'll put some things in the chat when I stop sharing my screen, and happy to take any questions or any feedback. So I will stop sharing the screen.
Thank Liz. That was terrific. That was more than I had expected, and I loved it. Just so you know, on the transcript, every time you said cannabis, it says we're free from Canada. So we're all free from Canada. So anyway, let's open it up to questions now. Does anyone have any questions for Liz on her presentation today or comments? Alberto?
Thank you. I have a couple. This is a loaded question, but first, how do you engage with property managers or agencies that are hesitant to engage with the community and with residents? So to do a community-based approach. Second, how do you, especially in this current environment, political environment at the federal level, what do you think are some of the most effective strategies to convey the message to still uphold social, racial equity in these policies? And, what have been some examples that have been very successful for you?
Sure, thanks. Those are all good questions. And, I think just starting out, we're going to have to continue to adapt to this current environment. And I think things have been changing so quickly that we'll have to take it bit by bit and figure out how we can best communicate. I think the second question first. I think the idea of involving residents in the discussions and not just saying, here's our idea, but we are hearing from folks that secondhand smoke exposure in your building is a problem. Can we have conversations? I think the more residents can weigh in on what they want to see and what they need, the more we can address their needs and avoid inadvertent negative consequences. An example, I was working with actually the county I live in. They were developing a smoke-free policy, and they had a broad stakeholder group to help develop the policy language, which was all professional folks. And then we took the language, the policy provisions that were under consideration, including the enforcement provisions options, to residents directly. And we thought the residents would say, absolutely no eviction. We don't want to see that. The residents said, we absolutely want eviction to be on the table, because these folks who are getting involved in the coalition, they'd been experienced in drifting secondhand smoke for 5 years. They had, little children with asthma attacks going to the hospital. They said, we want this policy to have teeth. We understand that we want to be supportive of our neighbors who are smoking, and we want to include all those components of education, cessation, referral, things like that. We don't want to have to get it to eviction, but we'd like it to still be on the table. And that was something the health partners never thought the residents would want. So that's just an example of, we can't assume too much of what the most impacted communities are going to want and need until we shouldn't assume. We need to get their input. And having things like surveys that folks can take where they can anonymously weigh in might be helpful, or because we don't want people to feel at all targeted, but we also want to create a space where they can be heard. In terms of reaching out to housing providers who may not be interested, that's a perpetual challenge. And I think folks who have found some good success have tried to reach out to where housing providers already are at, both in terms of what are the issues that they care about, and is there any way smoke-free can kind of be attached to that. For example, if they're talking about they're having like indoor air, doing something around asthma or indoor air quality, can you tie secondhand smoke exposure into that? Or if they're doing building renovations, like, wouldn't this be an excellent time to make sure that you keep your investment with your renovations? I know a number of states have had some good success with becoming members or even just occasional attendees to housing industry meetings, whether it's an apartment association or affordable housing developers association. Say, like, they'll just attend their meetings to kind of get a feel for what issues are their priorities, and then they'll offer to put an article in a blog that they may be having, or if they have any type of regular communication, say, hey, could I send out some info. Sometimes some of those lower cost type things have proven more useful than people had assumed they might be. some things that come to mind.
Thank you, Liz, for that answer. Pete, I see your hand up.
Yes. One of the things I wanted to mention that you mentioned the turnover as one of the motivations, and we were at a conference yesterday, and basically we had a booth, but they had sessions, and I walked in on one of them for a few minutes, and the focus was really the word that they're really concerned about is retention, which is pretty much the same thing as turnover, but that's the word that they were using, and they were trying to focus on different ways that they could retain the residents because it benefits their bottom line. For instance, one of them said that they had a 1 hour session that was required of all their residents before they could move in about all the amenities that they have and all the benefits that they have so that they know what's there and what they can use, and that seems to help with retention. And then, of course, smoke-free policies are going to be retention as well. And then I think a lot of people may not be aware that Colorado has new laws that make it harder to evict people. So that helps with our equity focus. But also, again, I don't think most housing providers would prefer not to evict people because again it helps them with that retention. But now they have to, for instance, here in Colorado now, instead of just posting a sign on their doors that says that you have to comply or giving them the first notice, they have to actually do it in person before they can start the process. So it does help also with the eviction process here. I think the only other thing that we didn't talk about, that you didn't talk about, but I don't know if it's appropriate for this call, is the different types of ordinances that have been passed in California. And I don't know if people would be interested, like new construction, nuisance laws, and all that stuff. But maybe that's a different conversation.
Yeah, we don't want to be California.
No, and
We
that,
want
yeah,
to be
Pete,
Colorado.
that's a different conversation, Pete, but an important one. But yeah, it's a different.
That's why I want another state to have local laws, to pass a local law, because then we can finally say it's not a California thing. It's at everything. It's available to everyone. One thing that's been very helpful, one of the big partners for all of us in working tobacco prevention is the Public Health Law Center based in Minnesota. And they are the ones who created the model ordinance for California's local smoke-free housing laws. But in the last year, they have released a model local smoke-free housing law language that's applicable to anyone in the country. So it's not just a California focused thing. So I think that is a very useful tool to support that eventual development of policies. And right, Pete, there's so many permutations when we come to the local law stuff. That could be a whole other conversation. But I love how you just talked about that conversation about retention. And there's so many things that we're in our public health tobacco prevention bubble, and then they're in their housing industry bubble. And even for us to do things like attend some of their meetings, even if there's nothing to do with public health on the agenda, just to understand what types of language do they use. Like, retention is what they talk about when instead of turnover, that's a more popular thing. So it's just so helpful for us to understand how to better communicate with those folks who are the decision makers for these types of policies.
Let me jump to Jennifer. We got 5 minutes left. We'll get Jennifer's question, and then I'll just close with a couple comments. Jennifer, what's good to meet you?
Mine's pretty simple. So in my area, I'm in a very rural area, live in Leadville, and I have not received any complaints. So my question is there a link or a phone number where residents can call like directly somewhere else versus the actual landlord to make a complaint? Or do they have to go to the landlord first? And then, because I would like to get it out in the open, like maybe put it on social media so that people are aware of it, because I feel like that people might not have access to it freely like we would like.
Yeah.
Liz, let me just answer that real quick for you can weigh in as well. But Jennifer, we talk about how do we collect these complaints on our website, Tobacco Free Colorado. We have a complaint site which says, "Are you being exposed to secondhand smoke?" And it's an outward facing site, and all the people from Colorado can't access that site and put in a complaint. And that's where we get those complaints in from Mariah. You can also on your own website, on your health, public health website, in your tobacco section, you can put that link. You can just copy the Tobacco Free Colorado link and put that on your website. And you can say, if you're having issues, because I always say that just because you're not getting complaints don't mean you're doing it right. It means no one can
Right.
find you. So make sure. So that's a really good point, Jennifer. And I'm happy to get with you later and discuss those options if you'd like to talk about that a little bit, how you can kind of market that ability to file a complaint anonymously without going through their housing provider.
Yeah, because I feel like that would be a really good soft educational like first step to someone versus going straight to their landlord, you know, and getting scared of possibly getting kicked out or whatever. Because I feel like if someone calls you and says, hey, I want to be anonymous, and then you contact that person that's been smoking in the housing unit, you go to them, give them the educational pieces, give them that chance to correct it, let them know what could happen. And then I guess I had one more quick question. So what if one of the landlords is very adamant about saying, like the slide that she showed us with, you know, like the 3-step, like they're very adamant, they want to be very blunt about it. And say you do try to pass a policy, you know, that's a little bit more lenient. Does that make sense? Did I say that right? Because some of the landlords are going to be sticklers, and I feel like some of them will want to evict. And like Pete had said, it is getting harder to evict because of the housing crisis, I'm guessing, and whatnot. So,
yeah, I would think in that regard, trying to help that landlord again, that coming back to that idea of like, you want to keep your tenants, and
right.
We want to help you do that. And it may seem like this is more lenient, but it's actually just it's a better way to achieve that goal of compliance and keeping the folks. So helping them understand the why. It's not just, we're not being all, soft on them. It's really, this is a more effective way to get them to follow the rule. And yeah, I think sometimes it's just, obviously, we all know there are some terrible landlords out there. And those are not the folks we are going to necessarily get on board, but that most landlords are trying to, not necessarily, even if they're not necessarily trying to do the right thing by the residents, they're trying to keep their residents to keep their bottom line. So, it does seem like there's some wiggle room, especially with the folks who are willing to have the conversation about implementing a policy from the outset.
And who is the enforcer on this issue? Are we as the grantees the enforcers? Because I was going to say we're not allowed. So I just pass policy and I can't enforce nothing. So it would have to be up to the landlord and the police if they have to. So then what if we don't have enforcement? Like, we don't have a lot of police here. They don't really, we had to have our public health do the enforcement for the policy that I passed because we don't have the actual police officers for enforcement. I know that you don't want police officers involved, but if it gets to that point, eventually you will have to have some type of authority. And would that mainly be up to the landlord then to contact the police to go further with that last and final step?
Jennifer?
Yes.
Liz, let me just say, that is a whole training. Your question is a whole training. And unfortunately, I have that training in the bag, and we're ready to present it. So all these answers are all these questions that you're offering. This is great. This is what our training is going to be about. So we'll dig deeper. I love that you have curiosity and your questions are very active. They're very on point to where you are right now, and we're going to clear that up for you a little bit. But I'm going to go ahead and close this out here because our time is up. Jennifer, if you want to stay on and chat a little bit, I have extra time.
I could do that. That would be great.
Yeah, I love it. So a couple of things that Liz said, y'all can jump off if you have to. I'm just going to close up here. Pete brought up the language, resident retention. That is so true. When he came out, he said, hey, they're using the word resident retention. So as we tabled and the folks come out, I just started using resident retention. And I'm telling you what, their ears perked up and they started talking. So definitely using their language matters. Also, these approaches are evolving. Let's remember, one time doesn't necessarily tip the Coke machine over. You got to kind of rock it back and forth. So we got to kind of keep going with these properties. Just because they said no one time doesn't mean they may not be ready the next time. So remember that these are evolving. And this is an investment in time. It's an investment of your time and their time. But one of the things someone asked about eviction, it's huge, and that's mainly why I got Liz here, because no one agrees on eviction. It's clear. They stated that. We do not agree on eviction. So one thing about this municipal ordinance, it suggested that that the smoke-free policy is not tied to lease tenancy. So it is simply a rule that you follow and is enforced by the public health department. That's the proposal in this policy Liz was talking about earlier. So it would remove smoke-free. It would remove the smoke-free policy as a tenancy expectation, but it would be more like a rule. So more on that. That was pretty interesting to me, and you can read more about that on this thing. I'm going to go ahead and let you guys go. Thank you so much for your engagement. Jennifer, I'm going to stay on so we can chat. Angie's going to stay on with me as well. Bianca, if you want to stay on as well to chat with Jennifer, that'd be great. Thanks, guys. Have a good day.
Thanks.
So Jennifer, let's start by saying you were totally correct. We have zero enforcement power,
Right.
zero,
Where
and
you,
we don't
what,
want it to be a police issue
Right.
either.
what
So
agency are you with, Jennifer?
I'm sorry.
Lake County Public. He just asked what agency I was with. Lake County Public Health in Leadville.
Yeah, let me stop the recording.
In what county?